Another thing is tendonitis, and that is inflammation of the tendon. You can get patellofemoral tendonitis. You can get tendonitis of the elbow, which is also known as tennis elbow. Wrist tendonitis, and tendonitis in the ankles, and essentially anywhere there's a tendon, if there's overuse and strain, which causes inflammation and swelling, then the sheath of the tendon gets, and the tendon itself gets inflamed. Tendons attach muscle to bone, and the tendon has a sheath around it. Okay, that sheath allows for sliding of that tendon as the muscle contracts and expands. Okay, for example, with your Achilles tendon, which attaches to the heel of the back of your heel, your Achilles tendon, when you stretch your Achilles or contract your calf muscle, there is a sliding of that tendon through the sheath. When you have inflammation, the tendon tends to swell within the sheath, but the sheath tends to not be as flexible. Okay? So the way I'm going to describe tendonitis is inflammation of the tendon. And the problem is when the tendon becomes inflamed, those fibers that create the tendon end up swelling. Okay? Those fibers are within the tendon sheath, and the sheath does not swell to the same degree. The sheath stays in the same orientation. So, if you've ever made spaghetti, you take spaghetti out of a long spaghetti jar or a cylinder, okay? And imagine the jar being your tendon sheath. Okay, it's glass or metal or whatever you keep it in, but it tends to be more rigid. Okay, now put spaghetti in there and pack it, and you can still move the spaghetti in and out when it's hard. Okay, now put boiling water in there, and all of those strands of spaghetti end up swelling a little bit, and those become so packed in there that whenever you move it, there's so much friction that you won't be able to slide it out very easily anymore. And that's the problem that happens with tendonitis, is you have those fibers that get inflamed and then push out against that tendon sheath and then become painful whenever they rub and try and expand and contract. So every time you have a movement that involves that tendon, you're going to have pain and reproduction of that inflammatory cascade. So it becomes somewhat of a vicious cycle. If you've ever had a tendonitis, it takes a long time to heal because it's hard not to move one of your joints, right? It's if you have a tendonitis of the knee, it's hard not to use your knee for a week or two.